The Black Studies program at Cleveland State University welcomes you to this season of Images, a public affairs radio forum dedicated to open dialogue on a variety of diverse topics of interest and issues of concern, which focus on the life and experiences of African Americans and all peoples of African descent. By visiting our website at www.csuohio.edu/blackstudies or calling 216-687-3655, you can learn more about upcoming Black Studies program events and activities. Now, here is your host for Images.
And welcome to Images. I'm Prester Pickett, your host for this broadcast of Images. We are in a conversation today with Dr. Brennan Brown, who is presenting a lecture here at Cleveland State today entitled The Wisdom of Wellness. Dr. Brown is medical Dr. Brown, and again, able to have this great welcome to this Images, and wanting to say that we'll have a chance to welcome you again here at Cleveland State University through the Howard Mims Cultural Center and the Black Studies program under the leadership of Dr. Thomas Bynum with your lecture this evening. A little bit of a meet and greet, yes. But this is like that meet and greet for our listening audience to know that you'll deliver this lecture, but they would like to know who Dr. Brennan Brown is. So if you don't mind introducing yourself to our listening audience.
Yes, absolutely. Thank you for the warm welcome. My name is Dr. Brennan Brown. I am a first-year psychiatry resident at University Hospitals here in Cleveland, Ohio. I am originally from Gainesville, Florida. I grew up there, was born and raised there, did my undergraduate there, and came here to Cleveland for medical school at Case Western Reserve University School of Medicine. So I graduated 1 year ago, and I'm working now in the Cleveland area.
Okay, and then with your history at Case, there are some outstanding goals that you accomplished while you were there. You developed some interests as well, so I'll ask you to share some of the things that you did while you were at Case Western Reserve University.
Sure. So when I started at Case Western Reserve, I was one of 2 Black women in my program, and maybe one of 12 underrepresented minorities in my class. And so generally the classes at Case are about 200 students. And so we were a small minority of students, in addition to being marginalized students of color. So me and 2 other of my classmates at the time decided that, we wanted to take strides to make more connections with the physicians of color in the Cleveland community. And so that was at least 7 years ago. So I think Cleveland in that time was, it felt to me a little bit more disparate. I knew that mentorship had been a huge part of me succeeding, me getting to where I was as a medical student. And I also kind of selfishly wanted to create a network of mentors for myself. I wanted to meet physicians in the area, people who looked like me, who treated patients that looked like me. So we moved swiftly to start a speed mentoring program. So it's similar to speed dating. We initiated that in 2012 was the first year. So we started a minority mentorship match program where we wanted to connect students in more longitudinal relationships with mentors that were more meaningful than just kind of putting a name with a name. We wanted students to get the opportunity to meet and sit down with physicians, feel like they built a connection, and then from there rank those physicians that they felt they were able to relate the most with. And so that was something that I'm really proud of doing, and it's still running. I think we're in a resurgence time because there's been a fair amount of underrepresented minority students that have come to Case.
Now, here at Cleveland State University, we have the MC² STEM High School.
Okay.
And this is where students develop the skills and the interest in medicine as early as high school.
Right.
Also at Case Western Reserve University, there's an Upward Bound program that directs high school students towards your field and your profession. Let's go back into your journey back to high school and think about those mentors that entered your life that early, and when you began to see yourself as potentially going to medical school, or were you considering another profession in high school?
Well, I actually knew I wanted to be a doctor since I was 6 years old. It has been my trajectory for as long as I can remember.
Now, what made that happen? What encouraged that early interest in the field of medicine?
That's a really good question.
6 years?
6 years old.
Oh.
I was fascinated by science. I was raised by my stepfather, who is a civil engineer, and so he was constantly reading and kind of always tinkering with things, and so science was really the thing that stirred me. But I was also, in the same sense, fascinated by people. I was always people watching. I was always wondering why folks did what they did, and so that really gave me a sense of interest in just how the human body works, how people, what goes into being healthy. And so from a very, very young age, I all I can remember is wanting to be a doctor.
And then you developed that interest and advanced through an undergraduate program where?
University of Florida.
And then you came to Cleveland, Ohio to experience our winter from a Florida life experience.
Yes.
What made you select Case Western Reserve University as an institution to advance your studies?
I was involved with I didn't have as much support as an undergrad as I can see is here at Cleveland State. I felt like I knew that my dream was to be a doctor, but I wasn't getting that guidance at a predominantly white institution as the University of Florida. I made my own network of friends and supporters, but when I got to the point where I was applying to medical school, I was kind of on my own. So I went to a conference actually for advisors and medical school programs, and I met the dean of Baylor's College of Medicine, and he and I connected, and I sent him my personal statement, which was, now looking back, very vulnerable, very open about the things that I experienced as a child and growing up, in an underprivileged area, growing up in poverty. And he loved my essay. He said, this is a fantastic essay. This is exactly what we want from a future physician. Just your authenticity, and it really struck me. And he said, don't just apply to Baylor. You may or may not get in, but you should apply to my alma mater. And I really took that to heart. So I did. I didn't know anything about Cleveland. I didn't know anything about Case. I saw that they were ranked, fairly highly, and I said, I'm just gonna, send this off with a prayer and, go.
The advancement in the discussion of adding the A to STEM to make it STEAM, your background and engagement with the arts, hearing that your writing skills advanced you into medical school, any other interests that you had to balance this focus in mathematics and science? Absolutely.
I've always been interested in writing. I actually am an avid journaler. So one of the things my dad did when I was growing up was get me, at my 12th birthday, he got me 7 habits for highly effective teens in a journal. And I've used a journal as a coping skill for as long as I can remember. And so writing is something I really believe in. I hope to write a book very soon. And it actually works because there is an art in medicine as well. And humanities and narrative medicine is one of my interests.
And now with your studies in medical school at Case Western Reserve University, eventually you select the field of psychiatry.
Yes.
What helped determine this as the next route in your life experience?
Very good question as well. I think psychiatry really just lended itself to me. I think I kind of feel like this is the field that I was supposed to be in. I feel as though there's a lot of inequity in health in general. I think for me, I've been very aware of some of the racial disparities in different, socioeconomic class and just opportunities that folks have. And psychiatry and mental health is one of those same, there's so many things to broach. There's so many ways that we can help folks more. And I realized as a medical student how important it was that patients' mental health was a primary focus. If they weren't able to, if we all aren't able to manage our minds and deal with the everyday stressors of our day to day, figuring out how to take my medicines on time and, figuring out what to do with, new symptoms I have, or even recognizing those symptoms can be an issue if I'm not together mentally and emotionally.
We are also preparing students to become medical doctors and work in the health professions here at Cleveland State University. Our own NeoMed is here as well, with Dr. Gregory Hall announcing he plans to attend your lecture this evening, and hopefully a large number of our other students who will have a chance to meet you at the meet and greet or at the lecture. With the students that would attend the meet and greet, what words of encouragement do you give to them? What words of wisdom, what words of advice do you give to them, as you'll be talking about wisdom of wellness, but wellness in the sense of how to survive the academic challenge of an undergraduate experience?
I think the wisdom I would have is to build your network. Find your tribe, for lack of a better term. Building a support system and having a safety net is one of the most important pieces of striving. As we achieve different things in our lives and as we go after different goals, it can be really important to reach up and reach out, because every step of the way, I've made it a point to try to find someone that's further along and find a way to make those connections. I'm not a stranger to making a cold email, finding someone, looking up a program or a department, sending an email and saying, this is my name, this is where I'm at, and these are the things I'm interested in. Do you have a minute to, sit down, connect? Because being inspired along the way is something that helps pull you toward those dreams that we have. And I would also say making sure that we also kind of are transparent and reach out to our friends when we're feeling vulnerable, reach out to a support system if we need it, making sure that you kind of stay connected, because in these systems and these institutions, medicine, higher education, there are fewer and fewer of us and people of color the further along you go, and so this can be an isolating experience. So making sure that you know yourself and find a community of connection is really important.
Now, Images also services us as a history tool, and we're able to think that 100 years from now someone can tune in and see what we were talking about.
Wow.
If we advance no further into the future than the invitation to your book signing, would like you to announce what chapters would discuss challenges in becoming that medical doctor, and then what chapters would discuss the successes for individuals to read.
Oh, that's awesome. I would say the chapters that were the most challenging and transformative for me was getting to medical school. Getting over the hump of becoming a medical doctor was a challenge in and of itself. But once I got to Cleveland and the adjustment of my first year of medicine, it took me back. It changed me. And so I would say those years are the most formative, the most challenging, because it really was me finding the strength and courage to keep pushing. Once I got to the field, I realized, maybe this isn't for me. We all have that part of us, that imposter syndrome, that we get to these spaces and we don't know if we belong. And so that was the most challenging, I would say, looking back in my past. And the most successful, I honestly would say this is a really time that I feel like I'm thriving in my life. I feel really blessed and really fortunate to be where I am. I feel really connected to my field of psychiatry, and I think there's a lot of really great work to be done.
And that work is occurring here at Cleveland State University, definitely because you have joined us here as part of our Cleveland State extended family through Black Studies and the Howard Mims African American Cultural Center with our interest in the field of Black Studies. We would like for you to begin to help us understand how your field is able to address cultural specificity, if you will, in the thought of the discussions of what is going into the diagnosis of an individual who is eventually determined to have a mental illness, and are there any specific things that a community member would be able to say, we're concerned about our family member, we're concerned about our neighbor in regard to potential of discussions about depression or being bipolar with those disorders, or even schizophrenia. What are things that our community in general can say we need to be attentive to in directing someone to your field?
Excuse me. Well, I mean, these are all really important questions. I think there's not one way to diagnose a mental illness, and what's important is that we, as those folks, those of us who work in communities and who are able to be connected with any loved one or a friend or someone else, like I mentioned before, making sure that we're checking in on each other. A lot of times some of the signs of depression and mood disorders, as well as schizophrenia and some of the other things, are, when someone starts to isolate themselves, when someone starts to pull away, when you see that friend of yours who was involved, more often than not, is overwhelmed and stressed. Some of the signs that people may not recognize are things like irritability and anger, and those things may be what come out on the forefront, but what's really going on underneath is more sadness and hopelessness. And I think one of the biggest pieces that's really important as community members, as concerned colleagues, is making sure that we create spaces where someone can be vulnerable about what they're experiencing, because there is a lot of stigma associated with mental illness, and that's just the reality. That's our country. That's our communities of color. That's even in medicine. There's a huge stigma that being diagnosed with a mental illness means that you're incapable, or that you're not intelligent, or that you're at risk of harming yourself or someone else. And those things aren't always necessarily true. So I think it's tough to try to make diagnoses, because we all really have times in our lives where we need support. But I would say being able to lend a listening ear, if you're concerned that someone is at a place where they could potentially hurt themselves or someone else, having the bravery and courage to reach out to that person, and if you're concerned enough to ask for a wellness check, to call on someone, those things are really important.
And you're here with us during the month of April, which is Minority Health Month for the state of Ohio.
Right.
We have other partnerships with entities like the Cleveland Treatment Center, where they are producing a play with music to celebrate the conversations of our community coming together to learn about health issues, including sickle cell anemia, as well as some of the concerns related to isolation, and possibly how music can help to address some of those concerns. With the number of disparities in regard to health care as it relates to the African American Black community, what is some of the goals you're setting to say that you can use your profession to help a Black community overcome these disparities disparities and then begin to live, the normative life experience that other Americans are afforded because of their cultures, investing in this attention to health care and other matters?
That's a really good question. It's something that I think about often. I think particularly in mental health, Black Americans, African Americans are less likely to be diagnosed with a mood disorder like depression or bipolar disorder than they are to be diagnosed with a psychotic disorder like schizophrenia or other schizophreniform disorders. And so there are things in just the sheer diagnosis of some of these illnesses that are disparities that really do affect the trajectory of the treatment that you get, because if you're misdiagnosed with, a different disorder, then you're not getting the medication that, that may treat what's actually going on. So I think bringing attention to some of the specific disparities in mental health is one way that I plan to be, plan to advocate for our communities. Another thing that's really important to me is just making sure that we can recognize that our physical health, our ability to exercise, the sleep that we get, our focus on the primary parts of taking care of ourselves is the way to improving our mental health. Studies have shown that African Americans and underrepresented minorities are more likely to get psychiatric treatment from their primary care providers than from more specialized providers like psychiatrists. And that's, could be due to many reasons, but providing access to primary care physicians is one way to ensure that more African Americans are getting access to the mental health care they may need, and that's an important thing. Building trust with a physician who will care for, they may care for your high blood pressure, they may care for our, diabetes, but, having that person that you can be vulnerable with and talk to about your mental health issue may mean that you get that referral to a psychologist or a psychiatrist when you may not have reached out to another mental health provider on your own.
Can you help a younger audience understand the difference between a psychiatrist and a psychologist?
Yes.
And even some of the older individuals in our community to understand which professional should be sought out for considered discussions in their lives?
Sure. So a psychiatrist is a medical doctor. This is what I trained in, and they've undergone training primarily in the diagnosis of disease, and they've also undergone training in medication management. So psychiatrists generally are the only providers who can, as well as nurse practitioners, who can prescribe medication. Psychologists are generally maybe licensed practicing counselors. They're also known as counselors or therapists, and those providers focus on psychotherapy, individualized therapy or group therapy, and that resource is something that I think is just as important as a psychiatrist. I am a strong proponent of psychotherapy. There are many things that medication only touches the surface of treating conditions that we see. Mental health is really about managing and using therapeutic tools to understand our life stories and understand ways to interact to kind of manage the stressors of every day.
Additional resources that are available in our community and things that the community should do to come together to develop educational programs or address this concern in terms of the stigma associated with mental illness, and to get people who may need to be considered for some support and development of support systems of even the family members that are associated with a family member who may have been diagnosed through your field. What recommendations do you give in directing people to resources? And you've been here in Cleveland for a while. Are there any particular resources that you can announce to us? And then even thinking of resources that can be afforded by someone with a low income, or resources that are even free.
So there are many free resources, and I think one that I'm the most impressed by that's a national organization is NAMI, N-A-M-I. It's the National Alliance for Mental Illness, and their website is NAMI, N-A-M-I.org. They are, like I said, all over the nation, and primarily run support groups and support for families and patients who suffer from mental illness. So I think that, creating programs and building support is really important. One of the ways that we can do that best is just to be open. Those of us who have close connections with others, those of us who know that, we may have family members who have suffered from mental illness, being able to open up and share those histories really does shape the space that we have to be able to share, these illnesses. I would say, in that same thought, suicide and suicide prevention is an important piece of this as well. Sometimes the first sign that someone may have, that a close friend or a family member may have, is that someone's attempted suicide, or unfortunately someone who may have died by suicide. So that is an important thing as well. The suicide prevention hotline is there, 1-800-273-8255. 211 is actually a free service that the United Way has. They offer a lot of resources. By just calling 211, anyone can get access to the Mobile Crisis Center that are here in Cleveland. Their number is 216-623-6888, and they are running 24/7 as a hotline, if someone is struggling. I think in my line of work, I've worked in the emergency room. I've worked in inpatient psychiatry is the work that I do now, and a lot of times, if someone's in the space where they may feel as though they have no one to talk to, just being able to call the number and have someone come out to check on them is enough to get someone through the hump in order to be able to seek out some of these mental health professionals. Well,
definitely we're looking forward to receiving more words of wisdom of wellness, even with Dr. Brennan Brown here at Cleveland State University and joining us. We have a continuation of celebrations of Minority Health Month in the state of Ohio, as well with the Songs of the Trumpet, the Donald Malloy story that is being produced by the Cleveland Treatment Center in partnership with our Black Studies program and supported by so many other entities. Again, that performance will be here at Cleveland State University on Saturday, April 27th at 7 p.m. There are tickets required, but these tickets are free. So again, learning of these great opportunities here at Cleveland State University. We also have a Bridges to Africa celebration on Friday, April 26th, where you'll be able to join us in the Howard A. Mims African American Cultural Center to speak French or hear others speak French for the first 30 minutes, and then eventually hear lectures about how French is being engaged in other departments, even the English department here at Cleveland State University, and hearing from some of our young community members. The opportunity for you to connect with us on Saturday, May 4th, as well, through our own Jazz Heritage Orchestra, which will have a concert swinging then and now, is something else that we would ask you to be attentive to in the consideration of calling us and contacting us at area code 216-687-3655. Once again, thank you for tuning in to Images.
You have been listening to Images, a public affairs radio program produced by the Cleveland State University Black Studies program and this station. The opinions expressed were those of the participants and do not necessarily reflect those of Cleveland State University, the Black Studies program, or the station. We hope you have enjoyed the music performed by the Jazz Heritage Orchestra. If you are interested in finding out more about the Black Studies program, call 216-687-3655 or visit our website at www.csuohio.edu/blackstudies.